I think the first thing I want to ask you about is, as outside observers, the rest of the world was amazed at the lack of preparations that appeared to have been made in India for a potential second wave. What do you put that down to?
First of all, I think we must see it in context. For the first 14 months from January of last year, the Indian government has been feted across the world for the effectiveness of our response. Right from January of 2020, the Prime Minister set up a high-level monitoring group which took very early action on restricting travel with China, early action on getting our responses ready, scaling up. You know, we are a developing country. Tremendous shortages of healthcare infrastructure, but tremendous scaling up happened last year in terms of beds, ventilators, PPE kits, etc. Also the national lockdown. But by the end of the year, when the cases had dwindled, there was a general consensus that we had beaten it. And this is not just a government viewpoint. If you look at the statements made by the opposition, statements made by healthcare experts, statements made especially by economists, that we were damaging the economy, we were hurting jobs, and we had to start making relaxations. So that brings us to the question that you've asked now. The reality is that while we had scaled up beds, while we had scaled up many other facilities, there are aspects about this second surge that, as Dr. Fauci in the US has said, nobody anticipated. For example, the difference in this surge is that the criticality of oxygen is of a different magnitude altogether. Now, the oxygen required for the hundreds of thousands of cases last year was of a different level. And what was required this time? Now, even there was anticipation, by the way. So, for example, last year, the union government anticipated this and funded oxygen plants to be constructed by different states. Now, we've had variable state capacity. A state like Assam, for instance, built all the 8 oxygen plants it was allotted, whereas a state like Delhi, which has had the biggest surge, could only complete 1. So,
yeah, but you can't get away from the fact that the World Health Organization and scientists across the world were telling us this isn't over yet. It's still circulating. We saw second waves in the UK, we saw second waves in America, we saw second waves in Europe. So India must have expected there would be more to come.
If you look at the national discourse 5 months ago, 6 months ago, while there were some voices talking about a second wave, a preponderance of the voices, including experts, said that we have done a huge amount of work which has cost the country also a lot in terms of jobs and the economy, and we had to do things differently. For example, there was a general consensus against a national lockdown, which is justified even today. Even today, with the very terrible second surge that we have had, it's not a national surge. About 80% of the cases are coming from about 10 states. So there's a different approach this time. Now, as I said, certain aspects were different from last time, unanticipated, and unanticipated in the UK, in the US, and here as well.
But you had watched it sort of spread throughout the world, so it feels from the outside that you were putting the economy above the potential threat to your people, the potential threat from a pandemic.
That's not true at all. In fact, very tough decisions were taken last year with the national lockdown. And throughout the second half of last year and the first month of this year, there was tremendous criticism for whatever restrictions that remained, because we've had millions of jobs affected. I mean, channels like yours and others have covered the tens of thousands of migrant labor who were stranded and distressed last year, despite immense amounts of government help to them. So no, we didn't put the economy above the crisis. But when the number of cases had dwindled to 5,000 or 6,000 in the entire country on a per day basis. It didn't make sense to have those kinds of restrictions. Now, as I said, if you look at, for example, the biggest crisis in recent weeks was oxygen. So you can see the preparation that was being made from October of last year.
Well, I don't really see the preparation, because actually what I saw, and I think the rest of the world saw, was a frantic attempt to get hold of oxygen, which isn't difficult to make, and India has plenty of, but it just wasn't enough of it here in Delhi.
So I think your viewers deserve to know the full facts. So yes, there is in fact no shortage of oxygen in the country. For example, states like Orissa, where I'm from, which is an industrial state with lots of steel plants, have tens of thousands of tons of oxygen. We have a logistics problem. Places like Delhi, as I said, this was anticipated. Action was taken, but we are a federal constitution. And the states have a role that the union government can't butt in and take care of. So for example, the oxygen plants which were funded a year ago, 1 year ago, by the government of India, have come up patchily. Delhi only set up one plant, and that's why the crisis in Delhi. And getting oxygen to Delhi was less of a problem than the distribution inside here, because that's in the hands of the state government.
But everything is blamed on the states. I understand the Supreme Court had to step in to sort it all out.
No, I wouldn't say everything is blamed on the states, because the states and the union government have cooperated. The Prime Minister has had regular meetings with the chief ministers of all the states, regular meetings with experts like the Indian Council of Medical Research, regular meetings with, of course, economists and others as well. Now, the Supreme Court has made rather strong remarks. If you go through those remarks, you will see they were very critical of the Delhi state government's internal arrangements. They made comments about getting oxygen to Delhi. Delhi was allotted by far the highest per capita allocation of oxygen of any state in the country, 10 times more.
But you still saw people dying on the street because they couldn't breathe.
Yes.
How do you feel about that?
I feel terrible about that, as would you, as do your viewers. And this is what we are talking about. That in a country of 1.4 billion people, we have a death rate that is far lower than the UK. We have a death rate that is far lower than most of the developed countries in the world. And that didn't happen accidentally.
But you will know that those figures are not trusted.
All right. So I think you have a very valid point there, because allegations are being made about the data. Now, if there is any alternate data that is more reliable, of course we will take that into consideration. Now, there are examples from, for example, hospitals or crematoriums. But even if you account for all of that, if you add up, we still have a far lower mortality rate than the developed world, which has much better infrastructure. So of course it's a terrible thing when so many people have died and so many people have been affected. But to try and lay the blame on lack of anticipation or lack of preparation is not entirely true, and it's not entirely correct.
But you must accept that there must be some part of that that's true, because there was full-scale panic on the streets here.
Yes, indeed there was. Let me point out, though, that the hotspots have been limited to a handful of places, such as Mumbai in Maharashtra, such as Delhi. We do have cases in other places. And as we've been talking about, there were certain lacunae which, despite all anticipation, despite the funding for oxygen plants which didn't come up in Delhi, is why you saw this crisis in Delhi. Now, why have you not seen a crisis in Assam, which has a bigger population than Delhi? Now, that's because all the oxygen plants funded by the union government were installed by the Assam government. Now, this is something you have to take into account.
Now, I also watched, I might say, although it's my personal opinion, in some horror, all those people went to the Kumbh Mela, which just seemed like insanity. I mean, what was the thinking from the leaders in India to allow the biggest gathering of humanity on earth to go ahead and then follow it with election rallies at a time of a pandemic?
So these are two very valid and important questions. They deserve a proper answer regarding elections and regarding the Kumbh Mela. Please allow me to answer them. As I said, throughout last year, because of the restrictions imposed nationally, all religious places were kept closed, all of them. Temples, mosques, festivals. As I said, by January, the cases had dwindled to just a few thousand. And there was enormous consensus. It's not just the government's opinion that you should start opening up. So from the first week of January, religious places were opened up, not just the Kumbh Mela. As I said, temples, churches, mosques were opened up from the beginning of January. There was a consensus in February when the Kumbh Mela had been permitted by the state authorities that outdoor gatherings were not as risky as before. Now, in the middle of the Kumbh Mela, when the cases started spiking, action was taken with intervention.
But it's too late. You know it's too late then.
Let me finish. And the Kumbh Mela was curtailed in the middle. Now, please also keep in mind that the hotspots that we have had, Delhi, Mumbai, Maharashtra, are not where the Kumbh Mela happened. They are not where elections happened. And that brings me to the second point that you had raised, elections. Now, we had the terms of 5 state governments coming to an end. As a democracy, we have an independent election commission which monitors and manages the elections. When they notified the elections, the number of cases were just a handful. Now also, if we don't have elections in a country like India, when the term of the state government has ended, now you've covered India, you can imagine what the chaos would be like. There would be no legitimacy about who would be in charge.
You could have them next year. I mean, what most people have done is just to delay them.
Yes, but you need to understand the Indian constitution a little better, and you need to understand the Indian situation. When a term ends, if there is no legitimate government in place, the kind of protests we have, the kind of riots that we would have, would be unimaginable. And also, in hindsight, when you have 400,000 cases is a different perspective. When you have 8,000 cases, it did not make rational sense not to have elections. And once again, please let me complete this. In the states that we have had elections are not where we have had hotspots. Now, we've not had a major crisis in Assam, nor in Tamil Nadu, nor in Pondicherry, nor in Kerala, whereas...
You'll know, though, just yesterday I was reading a report and watching a television report that said that people who were sent to oversee the elections and help with the administration of the elections have died in large numbers.
So the frontline workers, whether it's doctors, it's nurses, it's paramedics, are the biggest champions of the fight that we've had in the last 15 months. And yes, all of them have had a higher incidence of mortality than the average person who's stayed at home and has been secluded. Now, in terms of the election officials, yes, they may have had a higher incident than the normal population, but not in line with the healthcare professionals who are frontline workers.
I put it to you again that it looks as if the government has gone ahead with its own agenda at the expense and without thinking properly about the possible damage that's going to cause to the greater population.
And I put it to your viewers that that is just plain wrong for the following reasons. The government does not decide on elections. There is an independent election commission. Once again, in hindsight, and let me point something out. Last year, in the middle of the pandemic, from the first surge, we had a state election in the state of Bihar. This election commission then recommended that we do not have physical rallies, we only have virtual rallies. Now, the party in government, my party, the BJP, enthusiastically supported the idea, and we had only virtual rallies. Now, this was opposed by every other party, by every opposition party. Now, in a democracy, you can't just ride roughshod over the opinions of others. And every other party said that this was a murder of democracy and that physical rallies must be allowed. And that is why the Election Commission reversed its decision and allowed physical rallies to happen. But let me once again point out that the biggest hotspots and surges have happened because of local mismanagement of infrastructure, not because of elections, not because of religious.
So you're blaming the local government, the state government, not the national government?
Actually, I think if you look at blame, we can look at various things. I think in hindsight, there are things perhaps we in the national government might have done differently. Certainly the state governments, especially in some places where you've had hotspots, should have done things differently. And if you look at how we as Indians have behaved, while for most of last year we maintained the discipline of being masked, of being isolated, by January, when the mood was that we have beaten this thing, despite constant appeals by the Prime Minister, despite constant appeals by many other people, you saw people in markets and you saw people in restaurants again being casual about it. So I think we have to take everything into account and not just lay blame at any one place.
Let's move on then to vaccination, because that's the potential way out of this. India is the vaccination powerhouse of the world. You're providing the UK with many millions of doses of AstraZeneca. Yet the Indian government failed to put in orders to provide its own population with vaccination. How did that happen?
First of all, that's factually not true, and let me give you the full background about it. Yes, right from the beginning of last year, the Indian government, the task force set up by the Prime Minister, took early steps so that we would be preparing for a vaccine. We started off with the AstraZeneca vaccine produced by the Serum Institute in India. We set up 10 different labs to start studying the virus, so that we encourage domestic vaccine production, which has also now started with the Covaxin of Bharat Biotech. When we got going, by now, India has vaccinated Indians, which are 2.5 times the population of the UK.
But it's a tiny percentage of your population.
Yes, because
and you know that you need to get up to, they say, I think 90% of people need to be vaccinated to get herd immunity. So, 2% just isn't going to help you.
All right, so let's address that issue. Now, we have 1.4 billion people. We are a developing country. There are physical, logistical issues. So whether you have 60 or 80 million people as in the UK, or 300 as in the US, or 1.4 billion, the physical logistics of producing vaccines and distributing them are no different. So on a percentage basis, it will take us longer because we are a larger population. But because the situation looked optimistic, India responded to the appeals of other countries, not just the UK, but 80 countries. 80 countries have been helped by India with medicines and with vaccines. Now, again, in hindsight, you could say that we shouldn't have been generous.
What I might say is that that's about national pride rather than ensuring national security for your population.
Nonsense. What it is about is that we recognize that this pandemic is not just a national pandemic. This pandemic is a global pandemic, and we have to work together to beat it. Just like we took advantage of the AstraZeneca vaccine, which was developed in the UK, manufactured in large quantities in India, distributed to Brazil and to, as I said, 80 other countries. Now, it made rational sense at that time, because if our caseload was down to 5,000 per day on a national basis, it would have been irrational to say that we don't want to help the rest of the world.
But once again, I would say it's a lack of looking forward and being prepared for what might happen in your own country. So you were, as you say, offering your products to the rest of the world. India was selling, but it wasn't looking after its huge home population, which was probably the priority.
India was not just selling, India was also donating vaccines. India was also donating medicines. Now, look, if you, in hindsight, it's easy to make this kind of analysis. You turn the clock back 5 months, however, and it seemed that we would not have this kind of critical requirement of vaccines, and that we could take 6 months to roll out our vaccines, and in the process, the vast majority of the vaccines produced in India went to Indians, but a smaller proportion of the vaccines produced in India went to all these other countries, including the UK and the US. Now, at no point was a decision taken that we would compromise national health. At every point. Now,
so how long do you think it will take to get all over 18s vaccinated in India?
Right. So there are several hurdles that we have faced. You may be aware that our vaccine production faced bumps because of unanticipated restrictions suddenly placed on raw materials to be exported to India. For example, raw materials which are sourced from the US, we had a bottleneck, and there were a period of several weeks when vaccine production got hit in India because of the raw materials. Now, of course, our expectation had been, when we were reaching out to the world and helping with vaccines and medicines, that when India needed to scale up, the rest of the world would help us. Now, that may not have worked as smoothly as we had hoped for, but some of these problems have been addressed. The vaccination rate had dipped for several weeks because of what you've just pointed out. They have started picking up fairly quickly now. So the answer to your question is, so we should be at a pretty fast clip from the second half of June onwards, because of the lead time required to speed up the vaccines. Also, there are countries like Russia who have helped us out with vaccines as well.
Let's concentrate on India. Do you think that telling the states that they're responsible suddenly for all over 18s, which, as you say, in a country of 1.4 billion people, is a huge number of adults that need to be vaccinated, just announcing one day, all over 18s, you can go and get your vaccinations where you want, anywhere you want. Do you really think that can work without some administrative national process that will order it?
So again, that's utter nonsense. I think your viewers deserve to understand the full facts. Let me repeat. The Prime Minister has regular, couple of times a month, meetings with each of the chief ministers to review the national plan in cooperation, in coordination with the states, about how this is to be rolled out. Two things. The 50% of the vaccines that are acquired by the union government is going to all over the states, all over the country. Now, secondly, the states have been allotted vaccines as per the availability. Some of the states, and it wasn't sudden. That's where
it was one day.
No, it wasn't. That's what I'm trying to tell you. The Prime Minister has, all you have to do is just read the Indian newspapers for the last few months, and you will see that this plan was being discussed on a regular basis between the union government and the state governments. And maybe it came as a surprise to you, you haven't followed it. But it was being discussed. Yes, it was announced on one day, but it was discussed for several months before the plan was rolled out.
So it was just a coincidence?
No, it's not a coincidence.
That all over 18-year-olds were told to go and get their jab when there was utter chaos on the streets of the capital?
No, it's not a coincidence. Look, I thought this was supposed to be an interview, not an inquisition. But if you've made up your mind that there is only one narrative and the other side...
No, I'm giving you a chance to answer it.
No, you're not just giving me a chance to answer it. You're taking a particular line which wants to make the argument that everything was the fault of the Indian planning and the Indian government, and that's just not so. So, as I said, in discussion with the state governments, this plan has been rolled out, where the union government is funding half the vaccines, not for itself, for Indians all over the country. It was decided that, see, because of the time it's going to take to get the number of vaccines rolled out for such a large country, it was decided that the first priority have to be the frontline healthcare workers. The next priority have to be older citizens, who our experience was that older citizens were more vulnerable from the experience of last year. That is why that prioritization was done. Now, when it comes to 18 to 45s, there is a national budget from which not just the union government helps fund the states, but the states have their own health budgets, and it is intended for this kind of thing. And so, as I said, the 18 to 45 was agreed by everybody to be the second phase.
But do you not think it might need a little more coordination? Because there are such vast numbers involved here. As you keep saying, you're a developing country with this enormous population. Do you not think you maybe need to go age group by age group just to kind of bring some order to the process?
Well, look, that might be your opinion, but...
and I really want your opinion, though.
Let me tell you how the decision is arrived at. The decision is arrived by the Prime Minister having different kinds of coordination meetings. One with the chief ministers of all the states, which happens every few weeks. Also, in coordination with experts, such as the Indian Council of Medical Research, also with the industry itself, with the vaccine industry, the logistics, the railways to move, for example, oxygen and things like that. So considering that we are going to have a shortage of vaccines, when we can't, let's accept that we cannot vaccinate all Indians in one day or even 1 month. So there has to be a plan. And this plan is different from what we were looking at 6 months ago, because 6 months ago, the general consensus was that we could afford to be generous with the world and we could afford to roll out at a certain speed. We've had quite a bit of change of plans, and this change of plans is in coordination. Now, if you think that the Prime Minister needs to meet and discuss with the Chief Ministers more frequently than every couple of weeks, perhaps so, but I think a couple of times a month is pretty good, and to try and then work out the logistics is really more of a regional and a local issue.
So back to the original vaccine question, how long do you think it will be? Because there are suggestions that 7.5 million Indians a day need to get a vaccine to have everybody vaccinated by the end of the year, which is a colossal enterprise.
So the best answer I can give you, and I must tell you that lots of experts and the industry itself is grappling with it. So this is what has happened. We were vaccinating at a rate of about 3 million a day, and it dropped because of the constraints I mentioned, the raw materials imports and all, to roughly about 2 million a day. And it seems to be now picking up. We expect to be reaching somewhere like 10 million a day by the end of June or by the beginning of July. So yes, it will still be several months before we can reach the speed that is ideal, several weeks rather, and it will be several months before we can complete the level of vaccinations required.
I think just to finish, I want to know, India is an emerging powerhouse in the world. How does it feel to see images of people begging to be allowed into hospitals, dying on the streets, fighting for oxygen, or even for places in crematoriums, which everybody found shocking? How does that feel as a leading figure here in India, to know that's the portrait that's being put out on televisions across the world?
First, so that there is no ambiguity, it's a horrible feeling when we see people suffering like this, despite, as I said, enormous planning, enormous scaling up of our health infrastructure, and lots of efforts as we have outlined. But I also want to point out that the hypocrisy in how the Western media covers human dignity in times of crisis in countries like India compared to itself is something that is worth thinking about. Because it's not that the US didn't have large number of deaths. It's not like the UK has not had deaths. And there have been crises in many, many countries. It's galling to many Indians that in the midst of our misery, to try to treat human dignity with that cavalier attitude is something that has hurt a lot of people. We recognize that we have a crisis. We recognize that large numbers of people have gone through very difficult times indeed. And everything is being done. From the Prime Minister downwards, people are working round the clock to address the crisis. And as you can see, the numbers in the biggest hotspots have plateaued. The numbers plateaued in Mumbai a few weeks ago, and the numbers plateaued in Delhi about a week ago. So obviously, some of this is beginning to bear fruit. I wish the Western media would apply the same standards to India when it covers such large-scale tragedy, simply in terms of how human dignity is to be portrayed.
Can you expand that a little? When you say it's a cavalier attitude, do you think those images shouldn't have been shown?
I think the facts could have been covered with more sensitivity. It is a fact that we've had large numbers of cases and deaths. I think it could have been covered with more sensitivity. Whether it's a pandemic, whether it's a large terror attack, the way Western media covers blood and gore in countries like India is very different from how it covers it when it happens in London or in New York.
I'm not going to get into that debate about the coverage, but what I do want to ask you is, whichever way it was covered, those images have gone around the world. And
so I've answered that question.
But do you think that will harm India's image as this emerging power?
I think
because it takes you. The impression that it gives, from my point of view, and it is a personal point of view, is that it's a retrogressive step, that the health system couldn't cope, and that you're not a powerful, modern, emerging country.
I think certain sections are clearly trying to portray that aspect of India. There are many aspects which we should see holistically. For most of the last year and a half, India was celebrated in the way it has managed the crisis. India was congratulated for the help it has given to other nations. Now, despite what all you have just said, I would cite French President Macron, who spoke just a few days ago and said the world has no right to lecture India, considering the steps it has taken for itself and for helping the rest of the world. I'm confident we will beat this crisis. I'm confident we will get over it. I'm confident that as India becomes economically more capable, it will continue to be regarded more along the lines of a helpful nation that sees pandemics like this as a global crisis which we must fight unitedly, rather than taking only an internal view of such issues because they are global. Unlike other very large countries like China, for instance, India hasn't tried to hide the facts. India hasn't tried to just try to treat it as a problem that belongs to the rest of the world. We think it's a global pandemic.